Welcome to this mental health edition of The Answers. My name is Helen Kabahukia. Now, we know that mental health remains pivotal for human life. However, despite its importance, it's often the least prioritized in healthcare. In low and medium-income countries like Uganda, a demand for steadfast mental health care remains a luxury. Today, I'm joined by Dr Hafsa Lukwata, the Acting Commissioner for Mental Health and Substance Abuse at the Ministry of Health, who will delve deeper into the solutions offered by government in curbing the surging numbers for mental health issues in Uganda. Thank you, Doctor, for making time to speak to us. My name is Helen Kabahukia, and I am taking you through this conversation, and I would want the audience to know some of the programs that the government is offering towards mental health and mental health awareness. But before we go any further, how are you?
Yes, I'm very well, Helen. Very excited actually that we are having such a program, and I want to thank you for giving us this opportunity as a mental health as in the mental health programming. We want to thank you for giving us this opportunity to be able to talk about mental health this month.
But for you, particularly you, how are you?
Yes, I am very well. I am fine. I am okay. I think I don't have any big problems. I'm coping with whatever stresses I'm going through. There are not so many. So really, I'm fine. I'm mentally well and I am fine.
Now that we have established your mental health, we can now continue.
Maybe I could also ask you how you could be. Are you well, Helen?
I am well.
Yes, wonderful.
Yes.
Yes.
Doctor,
yes.
Without any further ado,
yes.
would want to understand when people speak about mental health, it is really broad.
Yeah.
As an expert in the field, how would you define mental health?
Okay, so mental health has been defined in many different ways. But for us as government or as people in Uganda, we've agreed to take on the WHO definition. It just says that it's a state of well-being in which a person can live productively. They can cope with the daily stresses of life. They can work to their maximum capacity and relate very well. So actually, I've paraphrased it. There's a way that they say it very clearly. But in all, it's about the ability of someone to really feel that they're themselves. They are capable of, doing whatever they can. They feel that they are, human beings. But then they can cope with the daily stresses of life, because generally every day we go through so many stresses. Some are expected, some are not, some are new, some are old. But also, like normally someone should be able to go through all that stress, manage it and not even be affected at all. But there's also being productive and doing things that are supposed to be done by an individual, but they're also supposed to contribute to their communities. We all live in a community, so it can be a workplace, it can be school, it can be home. So like someone can be able to, be productive in their spaces.
Yes.
So that's being mentally well.
Now, doctor,
yes. And does not mean it's not a mere absence of a mental illness.
Now that brings me to where I was going. There is a conception between mental illness, mental disorders, and mental health. And so many times we are mixing them up together. Where do we find the difference, and how do we diagnose that this one person is mentally ill, this one is having a mental health disorder, or this one is just having a shift in their mental health?
Okay. So what we need to tell the public is that mental health is lived on a spectrum. When I say spectrum, meaning we have two limits, two ages. There's the age where someone is perfectly 100% mentally well. No problems, no issues, no nothing. And then there's another extreme where someone is actually broken down. They have an illness, they're having signs and symptoms of a mental disorder. But many of us live between here, where we are not perfectly 100% mentally well, but we also do not have a diagnosable illness or disorder, as it were.
Okay.
So when we talk about mental health, it's just the whole thing, actually. And and given the definition of mental health, meaning that someone can be without a disease,
Yes.
but they're worried, they're not coping with certain stresses that they're going through, which could be rightly so. For instance, you could have lost a loved one, you're still mourning. When you're mourning, your mental health is not very well. You're not 100% here. But again, you're not on this other side, which has a mental illness.
Yes.
So when you're having, like, maybe your salary has delayed to be paid, or you're having issues with your produce, for instance, you're a vendor, a market vendor in somewhere, we know,
Daily
wherever.
challenges.
Yes, daily challenges. Your goods are getting rotten, they're not being bought, or they are delayed, your systems are delayed somehow. You're not okay. You may not even have a good night's sleep. You may have a sick child, you may have a sick relative, there's so many, those stresses.
Yes.
So meaning you may not be totally mentally well, but again, you do not have a diagnosable disorder, as it were. So most of us live on that spectrum there. We are not 100% this side and not 100% this side. So that's where the majority of the people live. And it's just the degree that varies. I mean, it's the degree of wellness that we all have, and we have different degrees of wellness, if I could say. Yeah.
Okay. Now, given that very spectrum,
Yes.
where do we stand as a country?
Okay. I think it's very difficult for now as a country to generalize anything. Different groups of people have different issues, but I can just tell you that throughout the life course, if I could say, there are different issues amongst the different age groups or the different pockets of people. I could start off with the children who are going to school. Most of the school-going children are having issues of very heavy workload, very heavy school things that they are needed to do. They wake up so early and they sleep very late. They're given a lot of prep. These children do not have enough time to do other things that they like most. Like maybe even some do not even have time for their friends.
Another person could argue that is promoting laziness.
No, it's not about laziness.
Yes.
I mean, I think that's totally different. When I want to talk with my colleagues, when I want to have time for my thing, that doesn't stop me from doing things that are productive.
Yes.
We measure laziness if you really fail to accomplish whatever tasks you've been told to do. But if I can do my tasks and, fulfill whatever I'm supposed to do, I should also have time to do my things as an individual. I may want to play music. I may want to play a sport. I may want to talk to my colleagues. I may want to do things that are personal, So if you don't give me my time, then I think you're affecting my mental health. And that's what is actually happening to young people.
Okay.
So these young people are having a lot of work, and they're not being given enough time to do things that children usually do. There's no playtime. There's no more playtime.
The schools would argue that there's co-curricular activities.
Yeah, but they're not doing them. They're not doing these co-curricular activities. If you just went into those schools, you would find that most of them, they're no longer doing arts. We used to do art and crafts. You would weave a mat, you'd weave, we would make these chair backs. We had opportunity to do crocheting, knitting and crocheting. We did art, we did collage. This is where you bring stones and put them in some bit of whatever, and then it creates a very beautiful picture. Most of our children are not doing that anymore. Most of our children are not even doing housework. Let me call it housework. At home, they cannot be engaged because they are very busy. But even most schools, even boarding schools, are no longer engaging children into things that will help them become, useful and responsible adults. So anyway, there's a problem. There's a missing link at that level amongst the children. And when it comes to the adult life, many people are in workplaces. People are having issues in their workplaces. They're not having enough. Some people are not being paid well enough. Some people are not having enough work. They're not doing work that they feel they're very comfortable with. They're just doing it because they have to get to earn a living. But many people, especially the professionals, are not doing work for which they went to school for. So that makes it very difficult for them to achieve or even to measure themselves how well they are doing. So that's one of them. But also we found places where the bosses can be quite bad and or maybe not supportive enough. They are very abusive. They are very demanding in the outcomes, and sometimes it's even beyond. Like many people feel they're not appreciated, and so those are some of the issues that can affect someone's mental health in the workplace. Then when it comes to home, when people go home, back home, they're having issues with meeting their daily needs, their basic needs. Some people are having issues with their renting. There are some that are renting, they may not have enough money, or they are not in places where they think that's the best place for them. They're just there because maybe that's what they can afford. We're having quite a number of people living in slummy areas and even semi-slummy, and of course no one wants to stay in such a place which is not very organized. There are just a few people who can live there. So all these things, the places where we live, the places where we work, are actually affecting our mental health. Then when it comes to the middle-aged, people having issues with their relationships. That's where most of the mental health comes in. People are not non-committal. When you find a man who is committed, the wife may not be, and the vice versa. Although for me as a woman activist, I find it's the other way around. It's mostly the men who are actually not committal. I'm sorry if I'm wrong. I'm not wrong. I think I've done a bit of research. So somehow this affects the women very much. We found single mothers. We're finding women who are living in marriages that are abusive. We have found people living in marriages where they have taken, the roles have been reversed, like a woman doing things that a man should have done, but just because that is what is expected of her, that she does it. But of course, under duress, it's not a common thing. And all these things break someone's mental health. I mean, when you think of, like, you could have used your money to do certain things, you may not be able to do your nails anymore. You may not be able to buy yourself a very nice piece of cloth because, you need to meet other needs somewhere else. So there's quite a number of things that are happening in families and in homes, in relationships. Then we're also seeing issues around, in relationships, again, we're seeing, yes, the non-committal, but also the lack of children. When people use drugs or people are very busy and most of the homes, most of the families that we are seeing are having children who are not being taken care of, who are not being parented very well. We're not parenting our children. So we end up getting other people to help us with parenting. And of course, that's a bad thing. When you come at the end of the day and you find a spoiled child, your child is spoiled and it's your fault that you're not with them as they're growing up. Those are all issues that are affecting our mental health as individuals, but also as communities. Then lastly, there's a certain group that is the elderly people. They're having issues with their mental health. Remember, they're getting old. They're no longer working. They're no longer having the basic needs. So they rely on their children or the people that they cared for. Some are relying on their pensions, which is not coming out very easily. So for those that are relying on their relatives or even on other people for their needs, basic needs, we found that they're not remember, the person is failing to meet their own, so they will not be able to meet another person's basic needs. Yeah. So we have found that the elderly mainly not being able to get whatever they're required to have as elderly. They're having not enough food. They're not having proper housing. They are not, even those that have a house somewhere, their needs that elderly people would require, like maybe a toilet, which is very good, where they don't have to squat because their bones are, their muscles are aching, that kind of thing. So somehow there's loneliness amongst that group. They may have lost their spouses, the people they're staying with. They may not even, these days we're no longer allowing our grandchildren to stay with their parents because of course we need them at home and that kind of thing. So somehow those guys are really lonely. So there's a bit of loneliness, but also a lack of basic needs. So what am I saying about the mental health problems? They are varied depending on the group, on the category, but also it varies amongst the different age groups, as it were. So when it comes, and I'm talking about mental health, but when it comes to mental illnesses, now this other side, there are quite a lot of mental illnesses amongst communities. It is known, WHO has given us some estimates. We've not had a prevalence study to tell us how much mental illnesses they are, but WHO has given us some estimates depending on, I think they've checked on our HMIS, that is the Health Management Information System. They've checked in our hospitals, they've checked in our communities, and have found that at least about 25% of the people, the adult population, may be having some form of depression. Then 10% of the people, Ugandans, we've been informed that they have some bit of anxiety. These are now disorders. These are mental disorders. Then we also know that about 10% of the adult population are actually abusing alcohol. Then about 2% of the people are struggling with the epilepsy. 1.9, about 2% of the population is struggling with epilepsy. This is a convulsive disorder where people, Then again, I think around 1% are also suffering with schizophrenia. Schizophrenia is the other severe mental disorder where people get onto the skips, like they have disorganized behavior. They are the ones that we see on the streets naked sometimes, and that is schizophrenia most of the time. So this is about 1% of the population, and yeah, so these figures really are big. When you talk of 1% of about 40 million people, that's a big number.
That's a huge number.
Yes, about 400,000 people are sick. So anyway, so that's the scope. That's the status of the mental health of people. It is not so good, but the fact that we have not measured it, actually, for me, that's my biggest problem as a program manager. We have not measured the numbers. We do not know the numbers exactly of the people who are sick. So many times we even fail to plan for them properly.
Okay. Yeah. Given the spectrum of that problem and the challenges, still withholding on the fact that you are unable to track the numbers and obviously offer some solutions towards those numbers, what are the available solutions that government has put in place in handling those issues?
So I think as government, we've had quite a number of reforms in our healthcare system that have actually addressed the mental health problems that people have. It has been slow, but I think it is purposed. And since 2000, in 1999, the country in the first health strategic plan, it made mental health as one of the basic issues that have to be addressed at primary healthcare level. It meant that any person with a mental illness, when they walk into a health facility, they should be able to receive care just like any other person, just like a person with malaria, just like a person with a cough. I'm saying it has been slow because once that was said, most of our health workers were fearful about mental illnesses. For them, they know how to manage malaria and their guidelines to treat malaria, their guidelines to treat respiratory diseases, their guidelines to treat. So somehow, the guidelines to treat mental illnesses remained within the regional referrals and the Butabika hospital, as it were. So other than the simple basic maybe stresses and most of these people are being referred to these places where they think the care is where they think there's care. But ideally, services were made available at the basic, that is a health center too. From health center to upwards to Butabika Hospital. Mental health was supposed to be provided in an integrated manner. So that is one. Two, we have provided medication. There's medication. We have improved over time. We have improved the quality and quantity of the mental health medicines within the health facilities, different health facilities. Of course, we cannot put all the medicines everywhere because, remember, there are no health workers who can be able to prescribe some of the medicines. So some of the medicines have actually been left to where the specialists are, and those are the regional referral hospitals and also Butabika Hospital. So somehow the medicines are available, and what we are trying to see is that once someone has been diagnosed, because we even say that most of the diagnosis of a mental illness should actually be done by a specialist. So if someone gets the diagnosis, they should be able to get their medicine, because remember, mental illnesses take on the chronic mode. It is not that you just take a medicine and then you're better. It usually takes on a chronic mode where someone has to be on treatment for a very long time. So what we've done is that someone is discharged from Butabika, but then they are referred to a lower facility where they can continue to get their medication. So that's the beauty about putting medicines at even lower levels. So people do not have to all the time travel to towns and big centers to be able to get this medicine.
Okay.
So the other thing is we've tried as a government to train healthcare workers. Remember, I was telling you that one of the things that failed us initially when we just started the integration was the lack of knowledge of the health workers. So we have adapted a module. It is called the MH Gap, Mental Health Gap Action Program. there's a module that was written by WHO. We've adapted it as a country that helps healthcare workers at the primary healthcare level to be able, one, to identify people with a mental illness, but also to be able to treat them. It is a program where we teach the already posted healthcare workers. If you're posted into a health center, too, would come and tell you that if someone comes in with this kind of symptoms, this person most likely has this diagnosis, and you can treat them using this medication. So these documents are there. We have left them in the facilities. They are there. People can be used by these health workers. Then the other thing that we have done is we are monitoring mental illnesses as they are being treated within health facilities. And here we have included, I think we have about 19 indicators or issues or conditions which we are following up. In other words, we are saying that if a person comes into a facility with depression, kindly note them down. If someone comes in with substance use, kindly note it down. If someone has epilepsy, so like we are following up on about 19 conditions in the HMIs, and that's a positive, because then we can easily plan. We can know we are seeing increasing trends in most of the mental disorders, and it's informing us that either our health workers now are able to identify these people, but it is also possible that the numbers down there are also increasing. So somehow it's informative. Whatever comes out in this HMIS is actually very informative.
Yes. Now, Doctor, I've heard you speak about Butavika in every statement, which brings me to the question of accessibility in rural areas. Yes. How far has government gone in ensuring that there's accessibility?
Oh yeah, we have tried. We know that. Usually, the way the health system is organized, it is in such a way that every level, like if we start with health center 2, it provides some services. Then health center 3 will provide whatever is in 2, and then we add on a few, and like that going upwards. So, and of course also increasing on the numbers of the health workers who are there, who are there to treat. So what we are doing, there are very few psychiatrists. We have, I think, about 50 plus or minus. These are very few. They cannot go around the whole country. Most of them actually are in Butavika and Mulago Hospital. So in Butavika, those are where specialized services are. So what they are doing, there are also a few of these psychiatrists at the regional referral hospitals. So what these people do, they come down, they go down, lower down, and mentor the health workers in the lower facilities. But also, in those lower facilities, they have outreaches. And these outreaches are done in the villages where most of the people are actually coming from. So what happens is that when there is a clinic day, for instance, a healthcare worker will come out of, for instance, Butavika Hospital and go to a district hospital or a regional referral hospital and work alongside the health workers in there. So then they'll be able to help them treat and give the right medication and diagnosis, as it were. So this is something that we have really emphasized. Most of the monies that are coming in at this level, of course the monies have reduced that are helping with the outreaches, but it is a program as a Ministry of Health that we are doing. We go down, the psychiatric nurses go down to the communities to do outreaches and reach out to the people who ever came into the facilities to know where did so and so get lost, because we know mental illnesses do not get better in 1 month or even 1 year. Someone can be sick for a long time, and most of the time we have found that these people actually just came off their medicine and they're continuing to loiter within the communities. So these ones help them to either bring them back or help them to get their medication back. So those outreaches are helping us. But another thing that we are trying to do is ensuring that users form themselves into groups. We have user groups. Once I get a mental illness and I'm diagnosed, I get my care, would train you to be able to help others. It's an advocacy part of things. It's part of advocacy. So we help this person to appreciate that they are sick, but also to look out for others who could be sick and excite them or help them to come within our health facilities. So these user groups are actually doing a lot of work of supporting themselves. They support themselves. They advocate. They make a lot of noise when their medicines are out of stock. They really remind us. They even can look for some funding for themselves to know that, like, if our medicines are not available in health facility X, what can we do? They mobilize themselves and get some money to ensure that these people actually have a constant supply of their medicine.
Okay. Now, Doctor, there has been a consistent conversation on psychiatric nurses, counselors, and social workers, where they're saying we are too many, but then half of the time we are either doing voluntary work or being underpaid. And yet I hear you say now we are training existing health workers. At what point does government now come and hear these voices? Because it's not the lack of manpower, but it's the fact that, one, private institutions are getting more expensive because they cannot be employed by government. And the numbers are still being reduced in all the mental referral hospitals that are actually going ahead to educate psychiatrists, counselors, and social workers.
Okay, yes, that is true. Now, the beauty about mental health that it is mental health can be offered in many different ways. It's not only in health facilities. Remember, I told you we all live on a spectrum, and I was telling you that many times we are not well, but again, we are not having a diagnosable problem. So what is happening within the health facilities? We are treating that small number, that number of people who are actually sick. But there are quite a number of people who are struggling. They are not yet sick, but they are not well the other side. So they need support. So that is where most of the mental health professionals actually are offering their care. And unfortunately, it cannot be offered within a health facility. It is offered within communities. And communities can be private, it can be within a church, it can be within an organization, it can be anywhere. So that's how most of the majority of the people, of the mental health professionals, are actually offering their care. But what has been happening within our facilities also has been that we are mainly recruiting psychiatric nurses without bringing on board the psychologists who offer the psychological part of things. We know that most of the mental illnesses, most of them are psychological. They do not necessarily have to be given medication, as it were. Some of them is about talk therapy. Some of them is about, just changing situations, helping to adjust situations within the spaces where we live and work. And then people become better. So what am I saying? Government lately has improved the structure, and it has included the counselors and the social workers into the structure. So when you get into a health facility, like a regional referral hospital, it has been improved mainly up to hospital level. We are finding these guys now, the ones who are not originally there, and now there. We are now seeing counselors. We are seeing the psychologists there. We are seeing the psychiatrists. We are pushing more now because even more are being trained anyway. So there are quite a number of them. We are trying to absorb them into the system. However, that said, there are quite a number of them who are still not yet employed because there are also many. There are many different varieties of psychologists. Here there are counseling psychologists. There are clinical psychologists. There are I think there are over 7 categories of them. I don't have them offhand, but there are quite a number of them. So for us, we are saying, can we have the counseling psychologists and the clinical psychologists on board? Then there are community psychologists. They are doing so many other things down there. So we are saying, let's take on, at least in our facilities, we'll take on the clinical psychologists and the counseling psychologists.
Okay. Now that brings me to my next segment. We as a newsroom are purposed to run mental health stories. And in running these stories, we found local rehab doing rehabilitation on substance use disorder. In a few words, could you explain to us the gravity of the problem that we have in the country when it comes to substance use disorders?
Helen, that's one of our biggest problems as a country. I think this is the biggest bubble that we are holding. One time, anytime, it's going to burst. People are using drugs. People are using different kinds of concoctions to help themselves. I don't know, cope with what. Even for some, it's just leisure, luxurious. Uganda is being ranked as the highest consumer of alcohol on the continent, Africa. That's a shame. And it's for just luxurious. It's not like street mates. It's not like it's food. it's just that people want to be happy, so they take on alcohol.
Yes.
The last that I knew was that 10% of people who take alcohol are actually having a problem. They are problem drinkers. There's this drinking and, one bottle.
Functional drinking.
The functional drinking, yes. It's like someone drinks and, they even go home and sleep. But there are those that cannot cope. There are those that cannot function without taking alcohol. And that is 10% of the adult population. 10, not 1, 10. These are millions. These are millions of people who are struggling. Once you're having a problem with substance use, you cannot be functional. We are prone to accidents all the time. Accidents, both road traffic, but also physical. These are people who are very angry. They can snap anytime. Gender-based violence. Someone can hit you with a stone, not knowing that they're actually hurting you. The euphoria that they have. They can imagine they are Jesus or they are God or they are, they're... So what am I saying about substance abuse? We are having a problem that is not yet appreciated by the majority of the people. It's a big bubble and it's going to burst on us. And I think it's going to hurt the whole of government, the whole community. And we need to do something here. So you may ask me, what are we doing as government? Yes. What have we done?
That was my next question.
Yes, I think we are trying to do things within our means or what governments can do, but somehow we are being disappointed or we are failing to reach our objective. I'll just give you an example of what we are trying to do around tobacco control. Smoking is one of the things that people take slightly, but tobacco is so dangerous in all its forms, and it's a major cause of cancer. And not only to the person who is using, but whoever is hanging around this person who is actually smoking. So lately, there are these shisha things. People have gotten into shishas, they have shisha dinners, shisha parties and so on. And every other, happening bar is selling shisha. We try to get to them. Actually, it is banned in the country. We have laws that are banning some of these substances. But despite that, people continue to go to do whatever they do. There's what they call the big person. They call them, how do they call it? It is above. They say above has said. Above is not allowing this to happen. This bar is managed by someone who is an untouchable. So that makes it so difficult for government or those of us who are technical to come in to really address some of these issues. So there's a bit of politicking around some of these substances. Then there is a bit of course, they have a lot of money. There's a lot of money. The people who are engaged in that business, it is really lucrative. It brings on a lot of money. Remember, it's an addictive thing, so people continue to take even when they do not want to. It's addictive, so they pay for it. So there's a lot of money. The Mongols, the many people who are dealing in there actually will do anything to fail any government program to run. So anyway, but what are we doing? We have a law. We have a Tobacco Control Act. We are getting into that Alcohol Control Bill. We have the Anti-Narcotics and Psychotropic Substances Control Act that has just been nullified by the Constitutional Court. The Constitutional Court, yes, and we say it's null and void now. But what am I saying? These laws are all there to help with controlling, the harmful effects of these drugs. The other thing is, as government, we have set up the Butabika. There's an alcohol and drug unit within Butabika. It's a big thing. It's full all the time, mostly with young people, 20 years, 24, less than 29 years. That's the majority of the people we are helping in those units. But that's the only government department. No, it's not the only one. Okay, of course, even the regional referrals, we have mental health units in the regional referral hospitals. So most of them are also managing issues related with alcohol and drugs. Those are the biggest. That's the biggest number of people who are, being admitted in those facilities. So those ones are there. But I think the majority of the people are going into the private facilities. There are quite a number of them. There are quite a number of private rehabs. I don't know which one you went to, but there are so many. And most of them are in Kampala, according to my statistics. We have more than 200 within just Kampala. And my problem with them is that everyone has their own model. Everyone does their own thing, Someone just wakes up and say, I've been a drug addict, so I know how to manage this. And they open up a facility, then they're calling on people. Those that are having problems, we can help you here. And they are not following any protocols, and that's the private institution. Somehow people want to go there, but I think it's also because my facility in Butarika is also full most of the time. So we're having people on waiting list. They're waiting for a bed in Butarika Hospital to be managed for their addiction. So maybe for those that cannot wait, of course, they'll have to look for care elsewhere. So yes, we have those facilities set up. We have the laws we have put in place, and we're trying to enforce the laws. What more can we do? We just have to educate people and tell them about the dangers of these drugs. Drugs are very dangerous, and the problem is people start off when they're hiding, but once the problem comes out, once they get into an addiction, they cannot hide anymore. And an addiction is very difficult to treat. You would rather treat a mental illness than treat an addiction because it never goes. It will go for a small time, and then the person will go back into that thing. And it is very, very expensive.
Okay. Now, doctor, moving forward, in Gulu, there is a person that sings to people that are having mental disorders and mental challenges. And which brings me now to the next question of, are there collaborations or partnerships with people that are offering solutions away from government to at least support and extend help to the communities?
Yes, of course, there are so many. By the way, lately, in the last 10 years, we have seen so many, over 50. I think I'm working with over 50 organizations that are offering support in mental health and in different ways. Yes, I'm glad to hear about those that are singing. There are those that offer play therapy. There's what, I mean, in different ways, not necessarily treatment. They're not treating because we are treating within facilities, but they're offering care. There's counseling. There is offering support, group support therapy. There is also counseling in groups, the IPTG. Then there is also, I've talked about the play therapy already. So there are people are doing so many different things. And yes, and I'm happy because this one does two things. One, it heals those that are having issues, but it also prevents the ones that could have, because of whatever they are going through, it prevents them from actually getting into having mental health problems. Because we know what music does. Music soothes the mind. It helps to heal. The messages that are in the music also can be very healing.
Yes.
Yeah, and of course there are also the spiritual people, the spiritualists. There are those that are known, like the churches, the mosques, and all those. But there are also those that that are coming on just and even like breaking the system. Like someone comes in, of course, when you're on medication, you can also receive some support on the other side.
Yes.
But we have seen people where if they go into the spiritual side of things, they tell them that now they don't need the medicine, they need to come out. So those are, of course,
I will hold that story for another day.
Yeah, but they're also working somehow with the traditional healers.
Okay.
There are these people, the herbalists. There are those that know some herbs that can help. There are those people go there.
Integrated medicine.
They somehow go there. We are yet to, as government, to come out very clearly. We have the law in place, but it is not so clear. The policy is there, but it's not so clear of how we should be able to work with them. But for me, I have no problem for as long as for those that have already a diagnosis are being helped to get their care. But for those that have not yet been diagnosed, or those that do not have that severe illness, they can still be helped locally within their communities so that then they don't get onto the other side.
Okay. Doctor, my last question, it's on HIV and mental health. So we have HIV mental related disorders.
Yes.
How is the government empowering HIV centers to ensure that people are held properly and comforted and taken care of, so that their mental health is protected?
Okay. So Helen, as when you say government is big, but for me, I'll talk as a mental program, health, a program. We have had issues with getting ourselves into the HIV space, but to date, I'm very happy to let you know that in the last 1 year, I think last 2 years, they've been able to embrace. They've been able to appreciate that mental health was actually the missing link. People are failing to adhere to their medication. People are failing to reduce on their viral load or to take on their medication very well because of whatever is happening to them mentally. Yes. And so lately we have been integrated, mental health has been integrated into HIV and AIDS care. And what we are providing is that for every person who comes into the HIV clinic, we need to assess them. We assess their mental state, just asking them how they are feeling. The very first question, how are you feeling? How are you? You know, that your very first question that you ask them is what we ask them. And of course, many of them have issues, and we deal with them depending on whatever issue that they are presenting with. But there are those that are failing to have their viral loads going down. For those ones, we just purpose to have adherence counseling. We counsel them properly. We find out exactly what the problem is, because of course, some of them don't take medication, but there are those that take medication, which is not working on them very well because of other underlying issues. There's a lot of substance use amongst people who are having HIV. So yeah, for those ones, we try to help them out of the substance use, because we know that there are interactions. Once you take alcohol and you're on medication, somehow you'll get a smaller dose. The kind of medicine that will enter into your bloodstream will be prevented by the alcohol somehow, will interact with another substance.
Yes.
So somehow, some of them, that was a problem. And once that one is solved, we've seen like an improvement in some of people's HIV outcomes. But there are those that are also having issues because of their HIV. You know, when the virus or the effects go up into the brain, we have seen many of them having dementia. But they also those that get psychosis, the HIV psychosis. So those ones have always been cared for as long as there's a facility, for as long as we identify them, we treat them. They have always been treated. So those ones don't have a problem. Well, where there was a big missing link were those that were not coming out so clearly, because we are not asking, we are not helping them as we're treating their HIV. We are not catering for their mental health. Yeah.
Okay. Your last words and your call to action as the Commissioner of Mental Health and Substance Use at the Ministry of Health. What is your message to the community in regards to mental health awareness?
Okay. What I need to tell people is that we all have mental health. We all have mental health, but it's just the degree that is varying, meaning that I may not be well today, but tomorrow I will be. That does not mean that I have a mental disorder. I'm not mad. I'm just having a problem with my mental health. So we need to help each other out. Today it's me, tomorrow it's another person. I should be able to help myself, but I should also be able to help my neighbor.
Yes.
So I am asking us to really understand the issues around mental health. What causes another person to have poor mental health? Is it me? Is it because of another issue? What I'm saying is there are issues around the environments in which we live as people, but there are also issues in environments where we work. Those are the biggest problems. So if we looked in there and put our mental health properly as a country, I think we shall be sorted.
Yes.
It is not about money. Let me add this. It is not about money. We don't have to have a lot of money to be mentally well. Even poor people can have good mental health. And a rich person who has a lot of money may have poor mental health. So it is not about money. Let us not look at money as an issue. Let us look at ourselves as human beings and help ourselves to ensure that we have good mental health.
Thank you, Doctor.
Thank you.
And thank you for joining us.
Thank you.
You've heard it from the doctor herself. If you're out there and you're struggling with any mental health issue, please get diagnosed. Don't self-diagnose. And for those around people that are struggling with mental health, check on them. Do not give up and continue asking the most important question. How are you? Thank you. I remain Helen Kavahukia for Solutions Now Africa.